John. He is a grade 3 student. His teacher called upon his parents to inform what he noticed about him in the class. John was very slow in doing things, doesn't complete homework, cannot go well with other kids, cannot recognize patterns, difficulty remembering what just said or read, difficulty in writing. So, what could be the reason? Any guess? Yes, his problem is diagnosed as learning disorder. In this video, we will look into the types, symptoms, causes, diagnosis, and management of learning disorder along with the tips for parents. Types. Children and adults with learning disabilities see, hear, and understand things differently. This can lead to trouble with learning new information and skills and putting them to use. Dyslexia. It is a difficulty with reading, problem with reading, writing, spelling, and speaking. Dyscalculia. Difficulty with math, problems with doing math problems, understanding time, using money. Dysgraphia. Difficulty with writing, problems with handwriting, spelling, organizing ideas. Dyspraxia. It's a sensory integration disorder. Difficulty with fine motor skills and hand and eye coordination. Then balancing problems will be there. Dysphasia or aphasia. Difficulty with language, understanding spoken language, reading comprehension. Auditory processing disorder. Difficulty hearing differences between sounds. Problem with reading, comprehension, language. Visual processing disorder. Difficulty interpreting visual information. Problem with reading, math, maps, charts, symbols and pictures. Symptoms. Each learning disability has its own signs. Some of these symptoms can be found in all children at some time during their development. However, a person with learning disabilities has a cluster of these symptoms which do not disappear as the person grows older. Let's have a look at the major symptoms. Short attention span, poor memory, difficulty following directions, inability to discriminate between or among letters, numerals or sounds, poor reading or writing ability, eye-hand coordination problems, disorganization and other sensory difficulties. Other characteristics that may be present along with these symptoms are performs differently from day to day, responds inappropriately in many instances, distractible, restless, impulsive, says one thing but means another, difficulty to discipline, doesn't adjust well to change, difficulty listening and remembering, difficulty telling time and knowing right from left, difficulty sounding out words, reverses letters, places letters in incorrect sequence, difficulty understanding words or concepts, delayed speech development, and immature speech. A person with a particular disability may not have all of the signs of that disability. These symptoms vary from person to person. . Causes. Genetic. A person's genetics or heredity can contribute to their learning disability. Children who have a parent with a learning disability are more likely to develop a learning disability themselves. Individual differences in the brain. Everyone's brain is unique, right down to the way it takes in and processes information. These differences could explain why some children have learning disabilities. Structural developmental abnormalities. For example, hydrocephalus. It is the buildup of fluid in the cavities deep within the brain. Brain damage can occur as a result of this fluid buildup. This can lead to developmental, physical, and intellectual impairment. Secondary to brain damage. Brain damage during antenatal, perinatal, or postnatal period. It can be an infection, hypoxia, maternal distress, maternal disease, birth asphyxia, intracranial bleed, etc. Sometimes a person may develop a learning disability later in life due to the brain injury. Possible causes in such a case include dementia or a traumatic brain injury. Environmental factors. If a child is exposed to lead paint or lead in water, they could develop processing problem in the brain that show up as learning disorder. Diagnosis. Strategies for assessing learning disorders necessarily vary by disorder. Psychological assessment. It includes three major aspects: cognitive, affective, and cognitive. Educational assessment looks for level of achievement in different academic areas. Developmental assessment. The goal of a developmental assessment is to identify the learning environments and experience and to understand a young child's development and competencies in the areas of physical, language, intellectual, social, or adaptive skills. Assessment of behavior and interaction. It is to identify behavioral deviance and to get the level of social functions in children. Medical assessment. For example, neuroimaging and then blood test for chromosomal analysis, etc. to rule out other medical conditions. Management. Individualized Education Program, IEP. It sets learning goals and determines strategies and services to support the child's learning in school. Extra help. A reading specialist, math tutor, or other trained professional can teach the child techniques to improve his or her academic, organizational, and study skills. Accommodations. Classroom accommodations might include more time to complete assignments or tests, being seated near the teacher to promote attention, or providing audiobooks to supplement reading. Therapies. Occupational therapy might improve the motor skill of a child who has writing problems. A speech language therapist can help address language skills. Medication to manage depression or severe anxiety. Complementary and alternative medicine. Dietary changes, use of vitamins, eye exercises, neurofeedback, and use of technological devices. Together, these interventions can improve the child's skills, help him to develop coping strategies, and use the child's strength to improve learning in and outside of the school. Tips for the parents. Recognize and appreciate strength and weakness of the child. Praise their effort rather than the outcome. Provide breaks while doing schoolwork. Sandwich the difficult tasks between easier tasks. Involve in daily tasks. Do not compare. Make time for the child's preferred activity. Find a hook that keeps your child interested in school. That means children may dislike the school due to frustration about schoolwork. Find something about the school, for example, choir, band, sports club, science club, arts club, that kind of. So these are the tips for the parents. Hope you like this video on learning disorder. For more videos on related topic, please subscribe. Thank you. Keep smiling.